I'd like to welcome you to the informational session for the cervical spine surgery. We would like to thank you for choosing the South Carolina Spine Center and appreciate you entrusting us with your care. Our goals for today will include discussing what to do at home prior to your surgery, talk about your day of surgery instructions, what to expect while you're in the hospital, reduce any pre-surgical anxiety, talk about physical and occupational therapy's role in your care, and how you'll care for yourself once you're at home. I want to begin by discussing some of the terminology that you may have heard when you scheduled your procedure. A laminectomy is the removal of the bone that causes pressure on a nerve. The discectomy is removal of the disc. Fusion is permanently connecting two or more vertebrae to eliminate motion in the spine. The instrumentation refers to the titanium plates and screws that are used. And bone grafts are made of the bone and tissue that's used to fill a space. It can be harvested during surgery or in some cases may be cadaver bone. In the images that you see on the screen, on the left side you'll see is a normal disc. On the right side you'll see that the disc is herniated, meaning that the membrane is ruptured and the contents of the disc are spilling out and they're compressing down on the nerve root on the right side. That is what causes the pain in your back, your arms, and your legs, depending on where the disc is herniated at. A laminectomy is when we go in and remove the lamina. The lamina you'll see on the left-hand side is labeled, and it is that horn-shaped piece of bone that sticks out at the bottom. If you notice, it's causing some pressure on the nerve. On the right side, if you look and see where the lamina has been removed, the circle in the center, which is the spinal cord, is now opened back up, and that nerve root on the right side that comes off of the spinal cord is now freed up, and that should relieve the pain that is occurring. If you notice the image down at the bottom of your screen, that is what the laminectomy looks like from a different angle. It is common to have laminectomies or some sort of decompression in this procedure. In some cases, you may be a candidate to have an artificial disc placed. If that is the case, this is what the artificial disc looks like. The recovery process for an artificial disc replacement is just a little bit different. We do not use cervical collars for the procedure once you're in the post-operative period. The next image is of the cervical fusion. This shows actually what the hardware that's placed in your neck looks like. This is plates and titanium plates and screws that are used to eliminate any mobility or instability in the spine once the pressure is taken off of the nerves in the spinal cord. Pre-operatively, it's very important that you prepare your home for surgery. You want to make sure that you have groceries in your home, that you've prepared and stored meals that are going to be easy for you to warm up. Particularly if you're going to be spending a lot of time by yourself. Some patients may have a lot of family who's going to be around. Other people may be by themselves a little bit more. So you want to make sure you have the things that you need prior to surgery. We do suggest that you move regularly used items to counter or table height. We do not want you reaching up overhead and working and doing things after surgery, nor do we want you bending down and retrieving things from low cabinets as well. You need to remove any throw rugs or electrical cords that could cause you to trip. We want to make sure that your hallways and rooms are clutter-free and well lit. We do suggest that you place non-skid mats in the shower or bathtub. Have a comfortable chair with high backrest and good armrest. It's important that the chair that you choose for your recovery is stationary. We don't recommend anything with wheels or something that could easily slide out from under you and make you fall. You want to make sure that you have clean linen on your bed throughout the process. This just further reduces the possibility of your surgical site becoming contaminated. We do recommend that you have someone to care for your pets. Large dogs can often bump you or knock you down. Smaller dogs tend to get underfoot, and we certainly do not want you cleaning any litter boxes for the first few months after surgery. The last thing that you want to do when you have a back surgery is to risk getting a surgical site infection, and pets, if they're exposed to your incision site or if you're sharing beds with them, things like that, you can certainly increase your risk for infection. Infection prevention will begin at home prior to surgery. Anytime you have surgery, the biggest risk of getting a surgical site infection comes from the bacteria that resides on the skin. So during pre-testing, you were given 3 packets of the CHG wipes. You'll start using those wipes 2 full days before surgery, and you'll use your last pack the morning of your surgery. If you'll look on page 16 in your surgical guidebook, you'll see a diagram that outlines how to use those wipes. There are 6 wipes in each packet. Once you wet the wipes, you go according to the numbers. It tells you exactly where to use those on your body. If you're having neck surgery, you need to pay particularly close attention to your neck, front and back, depending on where your incision is, to make sure that you've really cleaned that area well. You will not apply the wipes to your face or your growing area. So you'll shower like you normally do. When you get out, you'll dry off, you'll wet your CHG wipes, and then you'll apply those to your skin. Do not wash them off once you've used them. If for some reason you have a rash, we do suggest that you wash it off with normal soap and water and discontinue using the wipes. And you can just let us know that you cannot use them. It's very uncommon that we have patients complain about any kind of reaction to the wipes, but if it's a problem, just let us know. Do not flush your wipes. They will cause pretty major plumbing problems. You need to discard them into the wastebasket. The second thing that we'll do will be to send in a prescription for mupirocin ointment to your pharmacy. We'll do that once you're scheduled for surgery. You'll use this ointment 5 days before surgery, and you'll use it twice a day. So for application of the mupirocin ointment, you'll apply a pea-sized amount to a cotton swab, and you'll swab both sides of the nose twice daily. This is to prevent any kind of MRSA, or as some people call it, MRSA infection post-operatively. MRSA is colonized in the nose, and you can often have it and not even realize it. So this will be to prevent any of those infections and cut down on any bacteria that might be colonized in your nose. So if you've not already been, you'll go to the Ready for Surgery clinic, which is formerly known as pre-testing. That is located right up the street from the hospital at the Tower Point office, 105 Vinecrest Court. If for some reason you need to change your appointment, you can call 864-725-4002. We do ask that you arrive 5 to 10 minutes prior to your scheduled time. You'll need to bring any insurance cards that you have, including private insurance, Medicare, Medicaid, and a photo ID. We recommend a state-issued ID. If for some reason you do not have that, bring your Social Security card and some sort of photo ID. Bring all of your current medications in the original container, no pill boxes. We do ask that you include any over-the-counter medications that you regularly take, vitamins, and herbal remedies. You may be instructed to stop or change some of your medications before surgery, such as blood thinners, insulin, or over-the-counter medications. They will also instruct you on what medications to take the morning of surgery. The nurse will review your full health history. Your surgeon or anesthesiologist will order lab work and other tests to ensure that you're healthy enough for surgery. Some of the commonly ordered tests might include blood and urine test, a chest x-ray, and an EKG. Please be sure and inform your surgeon of any infection, dental issues, fevers, rashes, or anything like that occurs prior to surgery. Not doing so can also often lead to surgery being canceled. This is an elective surgery, so we do not want to set you up for failure or risk any unnecessary complications. So any of these problems will need to be treated prior to having surgery. Your arrival time to the hospital. The day before surgery, you'll call 864-725-4001 or 725-4002 between the hours of 12 and 5. That will be the day before surgery. They will give you your arrival time to the hospital the following day. If your surgery is scheduled on Monday, you'll call on Friday between 12 o'clock and 5 o'clock, and they will give you your arrival time. On the day of surgery, when you get up, you're going to use your last pack of your CHG wipes. You'll need to make sure that you have loose-fitting clothes, such as shorts, t-shirts, lounge pants, something that's going to be comfortable and easy to move in. We do ask that you bring walking shoes, no flip-flops or sandals. They may increase your risk of falling. Your brace that was given to you prior to surgery. You will wake up in the recovery room with that brace already in place, so it's very important that it be with you. We also ask that you bring your spine surgery guidebook with you. We will often refer you to the information in the book, and it also has a lot of your follow-up appointment information. On the day of surgery, you'll report to the Childbirth and Surgery Center entrance on the Spring Street side of the hospital. It is right down from the B entrance. If you notice on the diagram, it's coded with the circle that has the yellow, red, and blue. On that side of the building, the panes in the glass panes on the side of the building are in those colors, yellow, red, and blue, so it's easy to recognize. You can bring one family member with you the day of surgery to wait in the surgical waiting area. Once your surgery is complete, the physician will come out and update your family on how everything went and where you can wait. Our visitation policy is subject to change, particularly due to the current state of COVID. We ask that you clarify any visitation-related policies with the surgery scheduler. For the procedure, you will have general anesthesia. The anesthesiologist will review your health and medication history, discuss any nausea or pain management concerns that you have. This is a really good time for you to discuss any history you have with a prior anesthetic so that they can make sure that they customize your anesthetic so that you have the best outcome with the least likelihood for any complications. This is an image of the operating room. If you notice at the back of that image, there's a CT scanner that allows the surgeon to precisely place the screws within about 1 millimeter of accuracy. They use real-time imaging, and this ensures that your hardware is in correct placement so that you don't have any pressure on the nerves or the spinal cord from the hardware itself. This is something that improves the outcome and decreases the likelihood of any kind of complications. Post-operatively, you will wake up in the PACU. You will already have your neck brace on if one is needed. You'll be there for about 1 to 2 hours. They will stabilize your vital signs. They'll do a neuromuscular assessment. They'll ask you to squeeze their hands, press your feet up and down, just to make sure that you don't have any weakness. And they'll also provide any comfort measures you may need, such as pain medication, treatment of nausea, that kind of thing. During your hospitalization, you're going to be asked to rate your pain on a scale of 0 to 10. The pain medication is prescribed based on how you rate the pain on the pain scale. So from 0 to 3, you're going to get the mildest medication. From 4 to 7, you're going to get something that's stronger. That's considered the moderate range. And from 8 to 10, we consider severe pain, so you'll get the strongest medication. It's very important that you accurately rate your pain so that we can make sure you get the medication that's appropriate for you. Your oxygen levels, alertness, and blood pressure are factors in determining if pain medications can be safely given. Some of the types of pain that you may experience after spinal surgery would include incisional pain, which is exactly what it sounds like. That's the soreness or pressure at the incision site. It responds very well to the pain medications. Muscle spasms are the tight grabbing sensation. Typically, after neck surgery, it's down the back of the neck and across the tops of the shoulders. We treat that with muscle relaxers 3 times a day. The nerve pain is kind of a tough one. In many cases, that's what brought you to us to consider surgery as an option. The nerve pain is the shooting, stabbing, or burning sensation that's in your arms or legs. The nerve pain can persist after surgery and may even be slightly worse due to the manipulation of the nerves during surgery. This will get better over time. In some cases, you may wake up and be pain-free in your arms or legs, but that is not always the case. Don't be discouraged if you have that persistent pain in the first few days, weeks, or even sometimes months post-operatively. Some of the treatment options for the nerve pain would include gabapentin, Lyrica, or even steroids at the surgeon's discretion. Remember, the pain medication will not make the pain go away completely. We aim to manage the discomfort so that you can eat, sleep, and participate in therapy. The pain medications are not scheduled, they must be requested. We do ask that you let your nurse know if the medication is not effective. Ask questions and be sure that you understand the pain management efforts that are in place. Some of the possible side effects of pain medications would include constipation, drowsiness, dizziness, nausea, vomiting, a dry mouth, or itching. If for some reason you have any of those side effects, please let us know, and we will certainly try to treat those as much as possible. It may be that we can add a different medication or change what we have ordered for you to try to make those side effects be improved or eliminated. An island dressing will be applied at the operative site at the time of discharge. The dressing should remain in place for the first 7 days unless it becomes wet or soiled. We will provide you with extra dressings in case you do need to change it. At the 7-day mark, you can remove that dressing. There will be some little strips up under that dressing. Those strips need to remain on until they fall off by themselves. That typically takes up to about 2 weeks, but do not pull at those. If you do pull at them, you risk opening up your incision or even getting a surgical site infection. You will commonly have what we call a hemovac drain after surgery. The drain is inserted near the operative site. It drains out any blood that could collect up under the skin. The drain normally is removed the day after surgery prior to going home. Your neck brace will be worn at all times except for when showering. The image on the left shows you the soft cervical collar, which is our most common collar that we use. On the right, for the more extensive neck surgeries, we use an aspen collar. We do advise you to uphold your spinal precautions, the BLTs as we call it. Your therapist and your nurses will be educating you on the BLTs. That means no bending, lifting, or twisting. The head and neck should be kept in a neutral position with a focus on turning the body, not the head. You cannot perform activities that involve working with your arms above your head during the postoperative period. Physical therapy will begin the day of surgery if you're in your room by 4 o'clock. They'll work with you on getting in and out of bed, in and out of a chair, walking, and climbing stairs. Occupational therapy will evaluate and assist with bathing, dressing, and hygiene. Assistive devices including a reacher, shoehorn, bath sponge, and sock aid can be provided if needed to prevent bending, lifting, or twisting. Some of the possible equipment needs could include a rolling walker, a bedside commode, or a shower chair. Insurance will normally cover a walker every 5 years, but it will likely not cover a bedside commode or a shower chair. If you feel like you need those items, we will certainly provide you with a prescription for those, but they will likely include an out-of-pocket expense. We're going to talk a little bit about preventing postoperative complications. Anytime you have surgery, blood clots is an increased risk. While you're in the hospital, you'll have antithrombic pumps, which will be applied to your legs. They pump up and give a gentle squeeze every few seconds to prevent the blood from pooling in your legs. We do ask that you leave them on at all times unless you're walking. We also will encourage you to walk early and frequently. When you're sitting watching television or resting in your chair, we ask that you do foot and ankle pumps every few minutes throughout the day while you're awake. A good time to remember to do those is during commercials. Anytime you have surgery, you're also at higher risk of having pneumonia. So on the day of surgery, a respiratory therapist will bring this device to your room. It's called an incentive spirometer. This is used to exercise your lungs and to really expand them so that you're not at a higher risk of having pneumonia. We do like for you to use this several times each hour while you're awake during the day. Your risk of infection will be prevented by using the CHG wipes that you began at home. We'll also use the mupirocin ointment in your nose twice a day, and you'll receive IV antibiotics in the OR. Anytime that you have surgery and you're immobile, you are taking pain medications, you're going to be at risk for constipation and ileus, which just means that your digestive tract really slows down. We encourage early ambulation, meaning walking. We want you to be properly hydrated, and we'll also use stool softeners to prevent any problems for you. It is very important that you not smoke or use any type of nicotine. People who smoke have a drastically higher risk of having postoperative complications, including poor bone fusion or what we call a non-union, the risk of surgical site infection, and problems with the spine above or below the level of the fusion. Transition to home. The discharge plan is discussed daily beginning the day of surgery by the surgeon, the therapist, the nurses, the case manager, and of course the spine care coordinator. The discharge needs are determined through the occupational therapy and the physical therapy evaluations. Your discharge planning options might include home with your family or home with PT and OT home health. At discharge, you'll be given a list of medications to take. The list may include new medications, and some of the medications taken prior to surgery may be changed or stopped until a later date. You need to take your pain medication exactly as prescribed. In some cases, if your prescription exceeds a certain amount of pain medication per day, you'll be offered a Narcan prescription. It is not required that you have it filled, but it is required through state law that we offer that prescription to you. You will avoid all NSAIDs, that is the anti-inflammatory drugs, Motrin, Advil, Aleve, naproxen, BC Goody powders, arthritis medicines, and aspirin until cleared by your surgeon around 6 months to a year after surgery. Anytime you need medication refills, we ask that you call the office. Calls received after 3 o'clock will not be called in until the following day. We ask that you give us at least a 24 to 48 hour advance notice before you run out of your medication to ensure that we can get your refills sent in time. Caring for yourself at home. You need to change your position hourly. You should be up walking frequently. We want you to wear your neck brace as instructed. No bending, lifting, or twisting. We don't want you to lift anything heavier than a gallon of milk. You need to be walking daily and steadily increasing your distance. We do ask that you limit your stair use the first week at home. I know in some cases it may be unavoidable, but you want to limit it as much as possible those first few days. After your surgery, you will receive a bone growth stimulator in the mail. This will be shipped to you by DJO Global Sales. The representative will contact you and come out and do a demo for you. This is just something to help the bone heal faster and to be stronger. You won't begin using that until about the 1 month mark. Once you do start using it, you'll use it 30 minutes a day for 4 months, just to help ensure that you have the best bone growth. We want to make sure that you have a family or a friend who works as your coach. They need to know how to change your dressing, signs and symptoms of wound infection, pain medication do's and don'ts, signs and symptoms of blood clots and pulmonary embolism, spinal precautions, meaning no bending, lifting, or twisting, how to properly apply your brace, how to assist the patient in and out of bed, how to assist the patient up and down stairs, and then also be familiar with the exercise program that you'll be following. If your family or friends have questions, then we are certainly willing to perform any education that is needed to make sure that they are able to assist you with your care once you get home. At any point during the process, if you have questions regarding your care, please contact the Spine Care Coordinator. The number is 864-725-5872. We'll be more than happy to help you in any way. We would like to thank you for joining us today. We appreciate you entrusting the South Carolina Spine Center with your care and look forward to serving you.